how do we know the vaccine is safe?
Yeah, so I think the biggest thing is the clinical trials it goes through. They focus on every single potential side effect. The way they work is they have a group of people who get a placebo, which is like a sham, or the actual not the actual vaccine, and the other one actually gets the vaccine. So they'll compare both groups, and so it's a randomized process. They can see if one group has certain side effects more than the other. So that is a very in-depth process. It takes a considerable amount of time to actually do that. We've had the clinical trials there were 4 months of clinical trials, and then since then we've had another 9 to 10 months of seeing it in the real world. And what we're seeing is the huge benefit from the vaccine. So right now, as of today, on June 17th, we have seen, and I feel like the vaccines and the electrical measures have helped with this. We've seen a huge drop in the number of active cases of coronavirus in Canada. So a month ago, almost at the beginning of May, there were 80,000 people on May 5th who actually had the coronavirus, actively had the infection. That has dropped now to less than 15,000 people in the entire country. So we've had almost an 80% drop in the number of cases. And we have not seen any major complications of that. We haven't seen an influx of people coming to hospital after getting their vaccines. Now, the vaccines aren't 100% effective. We do still see some people getting the vaccine, getting the virus and getting sick after their first shot. So it takes at least about 2 weeks for the vaccine to actually ramp up and turn your immune system on. And that happens for the first dose and also for the second dose as well. But we haven't seen, we're expecting to see people with reactions to it. We haven't seen any strong abnormal reactions. The other thing we do with these people who do have a reaction, we have an entire team of people who investigate based on the reports that have been sent by the healthcare provider. They investigate what's going on. If they still don't know what's happening, we have actually a team of specialists who will see patients as well. So if it's an issue with blood, they'll see a hematologist. If it's an issue with weird tingling sensations, you'll see a neurologist. If someone's had an anaphylactic reaction, like swollen lips or swollen eyes, they'll go see an allergy specialist. So whenever something happens afterwards, we have a team of people jumping on top of this right away, trying to investigate, is it due to the vaccine or something else? So as I mentioned before, like vaccine safety is a high priority in our province and country, and we want to make sure this vaccine is working the best and not having any side effects.
Perfect. Now you mentioned there that there was a 4-month clinical trial. How would that, the length of that trial and the scope of it in general compare to other drugs or vaccines that would be released?
Yeah, most countries require at least between 2 and 4 months minimum of background data to decide if they should approve a vaccine. So, and usually in non-pandemic times, we have that luxury to run a trial over much longer timeframes. But what we do in our country and other countries, that if there is an emergency like we're having right now, like a public health emergency, you can use shorter intervals of time, and they have to go through all the same protocols and process. And they have this large committee of experts who come from a variety of settings. And usually in Canada, they're all volunteers. In the States, they broadcast these hearings on TV. But they have to be independent. They have to show they have no biases, and they go through everything like a fine-tooth comb. So in times of pandemics, we will shorten the amount of time that we need. But the other thing, like what Christine said, is the scientists who've done this, they've actually worked on this technology for years leading up to it. So there's actually been a lot of work into these vaccines and how they develop and how they're used and how effective they are, even before we had coronavirus come on our doorsteps.
Perfect.
I know that gave me a lot of comfort when I found that out, because if you don't know, you think, well, how do they make it so quick? But it's not.
Yeah.
Yeah.